Welcome back, everyone. We have an excellent presenter up next. I'd like to introduce Christian Ortiz. She's a licensed associate counselor and also has a license in behavioral analysis. She is a behavioral health professional at El Rio Health. Christian was born and raised in Tucson, Arizona, so she's a native of Tucson. She graduated from NAU and also ASU. She has over 15 years of experience working with children, adults, and families in community school, nonprofit, residential, and health center settings. Most of her experience has involved working with youth from emotional behavioral disorders or developmental disabilities. Please welcome Christian Ortiz.
Thanks, Vanessa. Just warning, I am a little nervous, so I may stumble over my words. Okay. So when I was approached to kind of talk about autism spectrum, it's a very big topic to talk about, right? And so considering the amount of people that are here in person and virtually from many different settings, I thought it was important to really talk about kind of what is autism, what implies, autism spectrum. But I'm not going to go into depth into that because I think a lot of things that might help people, right, is how can we help, right, as practitioners working in integrated settings to support this population with children and adolescents and even adults, okay? So, okay. So the objectives for today is to identify at least 3 common symptoms of autism spectrum in children and adolescents, describe common challenges when providing integrated care services to children and adolescents with autism. And this will be an interactive session, so I will be asking the participants input as far as common challenges that you have dealt with in different settings. Define and describe positive behavior intervention supports. Thank you to Dr. Adolescents for kind of touching on that a little bit in her presentation. And describe how PBIS can minimize challenges of providing services for children and adolescents with autism in an integrated care setting. Okay, there we go. So what is autism? Okay, you're going to see rainbow here because they call it the autism spectrum. It looks different for everyone, and for anyone with autism, it's not going to look identical, right? And so you're going to see, 10 common symptoms of autism is, developmental learning delays, or over or under sensitivity to light, sound, touch, or taste, difficulty communicating, repetitive movements and behaviors, difficulty in social situations, trouble with transitions, attachment to unusual interests, recurring sleep problems, difficulty understanding emotions, and insufficient impulse control. And you're going to see, the spectrum can go from, a severe learning disability to also what I think, a lot of practitioners struggle with are probably, those with really higher functioning skills, and they have really, high IQs and, very good at certain things. And so I think there can be some confusion there for a lot of people, right? But they could have, poor social cues, they don't understand social cues, or they have high sensitivities, and so, so we're going to watch a video from Duke University that I think really kind of pulls it all in together as far as what is autism.
According to the Centers for Disease Control, autism affects an estimated 1 in 54 children in the United States. You've probably heard a lot of thoughts and ideas about autism, but here's an overview of what we know. Autism, autism spectrum disorder, or ASD, is a neurodevelopmental disorder that affects a person's social and communication abilities. Persons with ASD also have areas of strong interest and sometimes have repetitive behavior and sensory sensitivities. Autism is sometimes associated with strengths in the areas of visual memory, music, art, math, and science. But each person with ASD is unique. Autism is a spectrum disorder and varies significantly from person to person. Some people with ASD may require significant support in their daily lives, while others may need less support, and some live entirely independently. Changes in brain development associated with autism begin during the prenatal period. These changes are associated with differences in genetics. It is possible to diagnose ASD when a child is between 18 and 24 months of age. Early behavioral intervention helps children with autism learn to communicate and socially interact and has a significant impact on long-term outcome. Support for learning social and communication skills can be helpful throughout adolescence and adulthood. People with autism sometimes have other conditions, such as higher rates of sleep disorders, ADHD, anxiety, depression, and gastrointestinal issues. Treating these co-occurring conditions can make a big difference. As adults, people on the autism spectrum can become employed and contribute in important ways to society. The world is a better place if the qualities of people who are neurodiverse are accepted and valued. The Duke Center for Autism and Brain Development provides state-of-the-art interdisciplinary clinical care, conducts cutting-edge research, trains the next generation of scientists, and advocates for public policies to help ensure people with autism reach their full potential.
So that website has a lot of resources, and you will find that at the end of the slide. So if you want to go back and kind of look more into what Duke University does, with people with autism and their research and resources, that's a really good place to go. Okay, so the next, so the next slide is going to be kind of a simulation of what a person with autism goes through. So for anyone who does have kind of like hypersensitivity, either virtually or in person, I'm just giving you a warning that, it can be loud, there's gonna be lots of light. So I wanna be sure that I'm giving you that heads up of, if you find this triggering, right? But the purpose of this is to really kind of get that perspective. Okay, so.
I'm not naughty, I'm autistic, and I just get too much information.
So I'm sure that anyone working with children and adolescents may have experienced, a patient with a similar, behavior. And that can be hard, and it can be really scary for us because what we want to do is we want to help. And so we will talk about kind of maybe some of the challenges around that and how we can help. But before we move on to that, I'm going to ask that everyone gets into their seat because you are going to take a poll, right? This is my opportunity to assess, right? If people were paying attention and picking up on the symptomology, right, of the autism. So you're going to see 3 questions. You're going to have to answer them one at a time. And it's the same question, okay? What is a common symptom of children, adolescent with autism spectrum, okay? So once you answer the first question, it should allow you to move on to the second question. And then subsequently the third one. So I will give you guys a couple minutes to do that. And if anyone is having trouble, just raise your hand and let me know. Maybe just a few more seconds left. Right, so for the first one, I kind of put in other answers in there that I think are myths, right? That's like a common misconception about autism traits. And so 89% got it right as far as repetitive movements and behaviors, is something that you might see, right? Not with everyone, right? Everyone's going to be very different, okay? So there usually is 2 kind of major myths. Is like it's either really high functioning that people are like, oh well, that every child or adolescent with autism is going to be high functioning, right? Or you're going to see the reverse side is nonverbal, self-injurious behaviors, temper tantrums, running away, elopement, those kinds of things. And, they'll associate that, with autism. But as we mentioned earlier, it's very much a spectrum of what that will look like. So the top one, for the middle one, okay, trouble with transitions, okay, is the right answer with 80% getting that correct. You're going to see tendencies, right, as far as, as far as, consistent temper tantrums, but that's not a criteria per se that we look at. It's definitely, it is definitely a behavior that we see when you have someone who is, struggling with, these other things as far as the neurodivergence, right, with autism. But you may or may not see that. Oversleeping, typically it's going to be the opposite when you look at the comorbidity, is they really struggle with sleep. And I'll show you guys a slide of, all the different conditions and why integrated healthcare is so important, okay? And, let's see.
Which one do you want me to display?
Okay, this one's fine. And so 100% got the last one right? Difficulty in social situations. Okay, so those are just some of the common symptomology, okay? So now what we're going to do is we're going to move into challenges. So I did a lot of research in different areas, right? School settings, with, doctors and counselors. As a behavior analyst, my job is to work with people, not just children or, or adolescents with autism. Behavior analysis is really about, modification of behaviors through, outward conditioning and things like that. However, as a therapist, talking about the matters of the heart and the mind, a lot of counselors and therapists really struggle, with knowing, how to work, with children and adolescents with autism, even adults, right? And so we'll talk about what that looks like. So according to Malik Soni, U.S. medical students have reported not receiving sufficient training on treating autistic children, while those from the UK reported low confidence in their ability to manage care and referral of children and adults with ASD. Autistic individuals and their caregivers also see a need for physicians to have a better understanding of how to support individuals with severe ASD symptoms, facilitate more effective communication, and accommodate sensory challenges. Okay, raise your hand if that speaks to you, okay? And this one is, there's limited research on counselors working with the ASD population. And again, ABA, Applied Behavior Analysis, is typically the first treatment modality suggested. However, ABA is a behavioral treatment and not appropriate for social, emotional, and overall mental health needs. So why are counselors hesitant? One of the first concerns is that individuals with ASD do not respond the same way to treatment interventions as neurotypical children do. That means that services are unprepared to adapt, support, and treat this population. Some counselors mention a lack of training. Most counselors feel comfortable treating anxiety and depression, but the lack of training and understanding of individuals with ASD prevents some counselors from engaging in therapy with this population. Okay. Another concern counselors may have about working with ASD population is that the therapy process can be challenging due to lack of clear treatment goals, complex presentation, considerable time spent on care coordination, and slow rate of progress. Okay, so for the counselors in the room, does that speak to you? Raise your hand. So when it comes to integrated care, okay, you're gonna see on the slide is in the middle, you're gonna see those core autism spectrum disorder symptoms that we talked about earlier, okay? And then you're gonna see that you're gonna see behavioral comorbidities, medical comorbidities, biomarkers, and then genetics, okay? So one of the things that Malik and Sony talked about in their article is how parents, right, who have children with more severe, autism symptoms, might have an increase in these comorbidities and finding it challenging to find, right, practitioners that are well versed enough to do it. So they are looking at more research about how an integrated care clinic, who takes the time to train their practitioners in all settings, from medical office receptionists, all the way to the physician and everyone in between about what they can do, right? And so it is something that it's a good conversation to have, right? Because I think that we're definitely moving that way. And this training here is really to kind of open the conversation of the possibilities of what that could look like in our types of, integrated care settings. So here's where you're going to go back into the CVent, and I want to be able to get your guys' thoughts on challenges that you have been faced with when working with children and or adolescents with autism. So common challenges for practitioners. When I first started doing this presentation, I was focusing on the behavioral challenges, right? Specifically with the patient or individual. But as I was doing it, I was like, well, oh gosh, well, there's treatment challenges, right? And there's also setting challenges, the actual environment. So you can answer whichever, speaks to you as far as your personal experience. But what are common challenges that you guys have faced in working with in this population, whether treatment, setting, or behavioral wise? So I will have the Q&A open here. So you're going to go to where it says live Q&A. And kind of just start adding your thoughts and your experiences. So I won't be necessarily answering questions at this point until the very end. But yeah. No, it's the Q&A part where they're putting in. So, oh, sorry. Of course. So I don't know if you guys are looking at the Q&A as the challenges start coming up. Lots of really good stuff, okay? So, you know, from the treatment perspective, they're looking at as far as, you know, more need for more training. Someone mentioned being able to take vitals, right? Someone with pretty severe autism symptoms and a history of aggressive behavior, to, you know, what did I see here? Time constraints, difficulties staying on topic, you know, being distracted. And then as far as, let's see, behavioral, I think we saw more as far as aggression, I think is a really big concern for people. When a child is being triggered, lack of parent understanding of the diagnosis, having expectations that are too high for their child. Someone put weight management issues, feeling comfortable with prescription. Yep. So really, really good things. So it seems like this is, you know, something that most people have been faced with, whether, you know, a lot. And I appreciate the coaches, people saying that they really struggle with the lack of resources, you know, because, for example, like ABA therapy, you might be able to see a lot here in the Tucson area, but it's very sparse elsewhere. All right, so what do we do with these challenges, right? That's a huge undertaking, right? And so this is where PBIS comes in, positive behavior intervention supports. And I saw someone ask a question, it's like, what's an evidence-based practice in school settings? So positive behavior intervention supports, there we go. Thank you. So positive behavior support, okay, is an applied science that uses education and systems change methods, environmental redesign to enhance quality of life, and minimize problem behavior. It emerged from 3 sources: applied behavior analysis, the normalization, inclusion movement, and person-centered values. Okay, so the reason I put PBS is because when you hear PBIS, you're going to think of school system settings, right? Because that is where mostly it has been applied in a group of people. So what I like to say is the I in PBS is the intervention piece. Okay, what is the intervention going to be, you know, applied? Okay, so a lot of people assume PBIS is an intervention. It is a system, okay? And the reason I want to bring this up is because there is a conversation to be had about how PBIS can work anywhere you have a group of people. So although most of the research and most of the studies, right, are done in school settings, they are starting to explore PBIS outside of the school system. So I used to work in residential care, and that's a system that we use with our population there. And it can be with any population. Now, for the purpose of this presentation, I'm putting it in the scope of seeing it working with this particular population, but it can really be applied with anybody, okay? And so there is limited research on how PBIS works outside of the school setting. So I saw research articles on how they're doing this in foster care systems or individual foster homes, DDD facilities, juvenile correction centers, clinic centers, settings, right? So most settings will have a process on how to deal with challenging patients, you know, and so there's an opportunity here, okay? So I'll describe what PBIS is and kind of give you the theoretical framework. And then kind of give you universal strategies on, if there's something that you see or hear and you go, oh, I think I can do that. That's what I'd like you to take home with you today, because the smallest little difference, can help. So PBIS is a 3-tier support system, okay? So when you look at the tiers, okay, you're going to see the first tier, which is the bottom tier, and it's in green. And this is universal precautions. That means that whatever system you have, right, and let's use the school as an example so you're able to translate that, is, you go over the expectations, with all of the students, okay? And integrated care is every patient that comes into your clinic, right? They know what is expected of them. Be respectful to yourself, be respectful to others, and be respectful to your environment. And there's many guidelines of what that looks like. So everyone knows what the expectations are. And so to be able to figure out what those universal precautions are, you have to come up. PBIS is not something that's implemented by one person, okay? So typically, to be able to implement a system like this, you need leadership involved in, the different settings, from the medical to the behavioral to the operational, and then you collect data on where are we really struggling, okay? So if we're looking at autism, it's really hard to get vitals. That these kids and children are really triggered the moment they come into the door because they already know what's being, it could be considered an aversive stimuli, right? They're going to give me a shot. Heck no, right? And so the tier 1 practice includes clinic-wide positive expectations and behaviors that are taught. Establish clinic expectations aligned with clinic-wide expectations, a continuum of procedures for encouraging expected behavior, and a continuum of procedures for discouraging problem behavior, and procedures for encouraging family and caregiver partnership, okay? And so sometimes the slightest little things make a difference, okay? So this would be applied to all of that population, okay? Now, not all of the population will follow suit with your universal precautions. So they say anywhere between 80 to 85% will, and that's good. So your tier 2 is a targeted prevention, okay? So for example, here at El Rio, we have our behavioral health consultants, right, that are in the primary care clinic. And so if there's something that, they need support in behaviorally, this would probably fall into that tier 2 category, right? Everyone is trained under the universal precautions. You can have an MA who knows how to de-escalate a child because they've been trained, those kinds of things. But once that child is not really following suit, you might need additional intervention. So here, there's an intervention team that coordinates, right, what is needed for this particular individual. Typically in PBIS, you're going to collect data, right? So it comes from applied behavior analysis, which is very data driven. So what is the data? What was the behavior? How often? The frequency? What was the intervention? Did it work? What can we do different? And so there's an increased instruction and practice with self-regulation and social skills. Maybe there could be increased supervision of some sort, increased opportunities for positive reinforcement. So I've seen a PBIS system at an orthodontist office. And I was blown away because the orthodontist had, if you show up to your appointment, you're going to get points. And if you accumulate a certain amount of points, that translate into gift cards. or that translates into t-shirts. And if you're able to, you know, brush and keep your braces, and like, it was just like, I was amazed, right? I was like, they have pbis in the orthodontist office, right? And so they have that ability to increase the pre-corrections, right? You're teaching someone who needs that additional support. And so then the tier 3, which is going to be your, you know, maybe about 5% of that population, is going to be a multidisciplinary team of behavior support expertise. In these kinds of situations, you know, I would recommend a behavior analyst, if you have access to a behavior analyst, but there is specific PBIS training that people take to be able to know how to apply it. So you don't need to be a behavior analyst, okay? So as you know, many schools apply this, and you know, they don't typically have a behavior analyst, but they have behavioral professionals, you know, school psychologists that are also training these kinds of things. So this is where you're really making a very individualized plan with this individual. And so now, this is how it could look like, okay, in this type of setting. Okay, so again, this is just open for conversation, okay? So how the tiers can function in integrated healthcare settings. So everything on the green side, right, are things that I thought of, you know, as far as treatment, precautions and strategies, setting, strategies, and behavioral strategies, okay? So early recognition of ASD traits and use of screenings is important. I think that there's kind of, people don't know really what comes behind the diagnostic of a child and with autism and what that looks like. There's specialized training for developmental pediatricians, neuropsychologists, child psychiatrists who are that specialize in that area, that follow like a particular protocol to be able to diagnose. So for example, I, as a behavior analyst, BCBA, LBA, you know, I work with, you know, a child with autism after they've been diagnosed. So I apply the behavioral treatments. As a clinician, as a therapist, that's different, right? Because I'm trained to be able to diagnose someone with, you know, anxiety or depression or what that may be, okay? So autism is a little bit different. Staff trainings on ASD, internal referral procedures, and basic behavioral interventions. So basic behavioral interventions is, you know, positive, you know, experience with that child. You're going to see a lot of times it's like, get down to the child's level, right? You don't approach them too close and really, you know, kind of step back. There's definitely many different behavioral trainings available. I know here at Old Rio, they do kind of crisis intervention training, the CPI, right? Yeah. And so that has behavioral components into it as far as de-escalation techniques. You're going to look at the tone of your voice, right? The more you say, the less effective you become, you know, because sometimes as we get nervous working with a challenging patient, sometimes we tend to over speak, and that can also escalate the situation. So there's basic behavioral intervention skills that, you know, you can train not just for working with a patient with autism, but really everyone, okay? Communication is a barrier, okay, in a lot of situations. And if there's communication that's a barrier, sometimes we rely on the caregiver, right, to be able to interpret, you know, some of those things. There's something called a picture exchange communication system. I don't know if you guys have heard it, but it's called PECS. And PECS is the ability to have pictures and visuals, right, to be able to point to, right? So if you're having to work with a challenging child, you know, that struggles with transitions, taking the time to explain, right, what's going to happen. And doing that with taking your time and showing through pictures, right? Some providers take it upon themselves to learn sign language, because that is an alternative to communication. Worksheets, different things like that. But if there was a universal system, it's like, okay, I as a pediatrician know, like, I have to take vitals, I have to do this, and I have to do that. Show it on yourself and go, oh, it's okay, right? It'll be fine. And then, oh, every time that they do good, we're gonna get a sticker, right? Stickers are very inexpensive and everyone loves them. I've realized that everyone loves stickers, okay? So that way you're communicating what the expectation is from the beginning. There's also sensory adjustments. It's right here, there's an adjustment to the lighting for the presenters up top, right? Not too strong, it's a little bit dimmer, and that's nice. If you go to most clinics, it's bright, okay? It's very bright. Most offices are very bright. And so being able to have an option, of low lighting, if it's appropriate, right? To be able to do that. Noise reducing adjustments, okay? So you're gonna see a lot now, you're gonna have sensory friendly places to go. So the Tucson Parks and Recs are building, a park specifically, for people with sensory needs. The movie theater, will have very specific days where children with autism can go, and they have very specific adjustments for that. We can have a room where there's noise reduction around and sensory items for, to calm them down. And it's not as bright, there's not as many people, right? If that's available. Use of sensory tools. I've realized that most of us are pretty sensory and fidgety. And so it can really help with calming the nerves. So typically I do this, although I work with adults now, I have sensory tools in my office. And when I see them picking, right, at their nails, or they're really nervous, or, they're shaking their foot, I just go over and I grab a sensory tool and I hand it to them. They're like, can you use this? I was like, yeah, absolutely, right? So different things like that. There's also the use of like weighted lap pads, because in certain people, they like the feeling of a heavy thing. You can also put it around their shoulders. Again, availability of less crowded rooms, consider smell, touch, and sensitivities, okay? So, for example, if you're someone that has to put your hands on the child to do a physical exam, you may wanna, warm up your hands, or let them know, have them feel the glove before you put it on, right? It's like, I'm gonna put this on my hand, do you wanna put gloves on? Right? And so kind of like making it a game in a certain sense. More transition time. So inform patient what to expect, go over expectation, and reward desired behaviors, okay? We know that positive reinforcement works, right? And so you guys are doing a fantastic jobs with following along, and you guys are having your eyes on me. You guys are fantastic. That's amazing. I really appreciate you guys for that. Good job. Okay. The moment I said that, people who were looking down on their phones got their eyes back up. Okay. So those kinds of things are very good. Okay. High fives, elbow bumps, stickers, sensory items. And so you can have those things available, right? And you can reward everyone for desired behavior. Now, those are kind of the strategies that I think anyone can apply. Tier 2, you're going to look at, you're going to screen for tier 2 interventions, okay? So this is where you might want to consult with a behavioral health consultant or a behavioral health team, depending where your clinic is at. Identify the specific challenge and specific interventions, such as maybe you want to teach a specific skill, okay? They might need additional training, so before their next appointment, bring them in, go over a simulation, and then have them come in for their appointment. Identify possible functions to the problem behavior. Okay, so you're going to hear this a lot in behavioral interventions. What is the function behind the behavior? Most people know attention, right? There's escape. I want to get away from this task, right? There's tangible access, meaning I'm going to have a tantrum so I can have that really nice mug that's right there, right? And then of course the fourth function is the sensory function, which is the harder one to identify. And then identify more specific reinforcers to reward for desired behaviors and or replacement behaviors. Okay, so not only can you reward for desired behaviors, you can also reward if they did a different type of behavior. Okay. And then of course the third tier, that's going to be the one where it's going to be very specific. Okay, so involve a whole integrated healthcare team. You can consult with the BCBA, or you can also consult with the BCABA, which is the bachelor's level behavior analyst, or someone who really does specialize in PBIS. Use function-based assessments such as functional behavioral assessment. And if available, allow ABA therapists or other professional support professionals to attend appointments. So it might be good for you to be able to, have a conversation with a registered behavioral technician who works with a child with autism to be like, what should I expect, right? So when you do your appointment reminders, maybe that could be one of those universal precautions, right? What specific things will this child need that we should be aware of? What do they struggle with? Are they aggressive? And so kind of having a screening tool to be able to help the practitioner. And as far as therapy, use of acceptance commitment therapy. They're realizing behavior analysts is the board associate behavior analyst certification board now recognizes acceptance and commitment therapy as a preferred method for therapy for children and adolescents with autism. Okay, it's a little bit more flexible. There are behavioral interventions. You take your time, whereas something like DBT, if you're going to do dialectical behavioral therapy and you're following it by the book, that typically will not be as good, right, with this population. And they are doing a lot more research on play therapy, okay, in these types of situations. So this is just kind of a glimpse of like, all right, this kind of looks good. I kind of like how this sounds really nice, have that conversation, because it's doable, okay? All right. So now it's time for questions.
So then you just present them to her, like tell her what they are.
What parts of brain function differently and how in people with ASD? That's a really good question, and I don't know the full answer to this because I'm not a doctor or a neurologist. But one of the things that you will see as far as autism and brain functioning is there is a tendency, right, for the concrete thinking side, very pragmatic. And I think that falls into the social cue side and being able to understand language and those kinds of things. So that's a really good question. I don't know if there's a doctor in here that knows the answer to this specifically and where it's targeted. But yeah, I don't know. Oh, challenges with telehealth. Okay, yes. So one of the things, oh gosh. During the pandemic, I was definitely in sessions with technicians trying to apply behavioral interventions in telehealth. And let me tell you, like, even we were struggling with it a lot. So, so a big thing is what we notice is gonna be more effective is you get the caregiver involved. So they're the ones providing the direct reinforcement, for the desired behavior. Whereas a lot of times, if you're doing a session, a lot of times the parent is observing, what the analyst is doing or what the person is doing. And so getting the caregivers buy-in and saying like, hey, I really need to get through this. And, can we reinforce the child for 2 minutes of engagement? Great, take a minute break and then get them back. Because I think a lot of times we're really focused on going from, the beginning of the session to the end of the session and hoping that that person's going to maintain focus that whole time. That's challenging for a neurotypical person in general, okay? And so being able to provide the modification for breaks and for those reinforcers and making it very specific on what you want to target during that session. Can you talk about differential diagnosis, ASD versus effects of trauma and neglect? Ooh, that's another really good question. And the reason it's a really good question is because a lot of children with behavioral issues have trauma. And that's a lot because the caregiver doesn't know what to do, in these situations. And so really kind of what we look at is that that's a really good question, right? Because as a behavior analyst, I'm trained to look at just the environment, right? As behavior analysts, we're not really trained to look at trauma effects, and being able to distinguish the difference. We're just specifically trained to look at the environment, modify the antecedents, right? And, and look at the consequences after the behavior with different behavioral interventions and strategies, okay? As a therapist, I'm looking at, oh man, that must have really hurt. Did that hurt your feelings? Right? Were you able to share those kinds of things? And so I honestly don't know how to answer that question either, just because I think it's a more, complex answer. I don't know if I'm really understanding it, but to be able to diagnose, I do know that most people do not feel comfortable diagnosing autism due to lack of knowledge. And so, yeah, I don't know if I really answered that question, but I'm gonna think about it. I struggle with when a student shuts down and refuses to acknowledge what he does wrong. How do I then proceed with him? Okay. So accountability, I feel, is something that everyone struggles with. And it's one of those things where it could be, they're just not ready. They're just not ready to have that conversation. And so many times when we're frustrated about our needs, we may, forget that that other person has needs and what is it that they're needing, right? And so for the most part, I'm going to tell people, it's okay not to have that conversation right now. It can be an ongoing conversation about, when it's time to look at what happened. And because when you're in an escalated mood, I always tell everyone that's not the time to problem solve. Okay, so you're going to wait until after there's a de-escalation and both are calm and both are, being logical and reasonable to be able to be like, all right, well, let's talk about what happened. There's lots of feelings there. Okay. So really kind of more validation and empathy that that person is going through something. How are practitioners involving, informing, educating, and supporting parents into the treatment planning and care of children, youth, and adults with neurodevelopmental differences? How are practitioners involving? Okay, so I can speak to my experience as a practitioner is that it's very much very involved. I think kind of like with people in this setting, it's hard to tell, especially if you don't feel very comfortable in, treating a child or adolescent with autism. But it's a very integral part because they're usually the ones taking their child to get the support and the help that they need. So if you look at a lot of the autism screenings and evaluations, it's going to be a lot of parent involvement, parent-led, getting information from that parent. So yeah, they're definitely an integral part. And to identify that as a practitioner is important. So if you are working, right, with a child that you're struggling with that has autism, have that conversation because they're going to be the experts of that, okay? So I do believe that there's opportunities for further training and growth on how you can do that. Motivational interviewing is a great one, as Dr. Adolescents mentioned, because it can also be very difficult, okay? Because a lot of parents also want what's best, but also are scared. So, right. I think that's my time. All right.
Well, just one more.
Just one more. Challenge of parents wanting their child to be normal. Yep, I definitely get that. And as someone who's worked with a lot of families, I kind of give this metaphor, right? Well, first of all, I go, I don't know what normal is, right? And so I kind of talk to parents about how there's a grief and loss, right? There's a grief and loss about what your expectation is of what your child, quote unquote, could have been or what they could do and those kinds of things. And I really, really do empathize with that, in being able to have that conversation about, I can't imagine, how hard that could be, and so I kind of talk to parents about how they might be expecting, their child to get to this point where they're quote unquote normal. As I don't know if you guys know, but there's no cure to autism. Okay, so you really work at making them more functional. And so if I ask you to run a full marathon right now, are you going to be able to do it? Well, no. Okay, yeah. We might be able to take a mile walk. That's what we're looking for, right? We're striving at taking baby steps and they're usually really receptive, especially, when I remind them that they're here because they love their child.
Thank you very much.
Thank you.
Thank you all, and thank you, Christian, for